গরমে।
Hello, I am Dr. Bishyash. I am a doctor of this clinic. I confirm that you are Mr. Rahul Dravid, 28 years.
Yes, doctor.
Okay. I got letter from your GP saying that you have red eyes for a couple of days. Is it right?
Yes, doctor.
Okay, so can you please tell me in more details about your condition?
Well, doctor, actually, around 2 days back, actually, I started to feel that I have slowly gaining some pain in my eyes. At first, I didn't notice, but uh, actually, my mother then told me that she thought there was some redness in my eyes, and gradually over the last 2 days, I think that I also have grown some problems while going to bright light. Okay, and also some pain in my eyes and this redness. So I'm a bit worried, doctor.
Is it
What
the
can
first
be
time or
the-
you have this before?
Doctor, I had one episode of this before,
And
but
when
it
did
went
it
on, went
happen?
on at on its own, went away on its own.
When the first episode happened?
I think around 1 year back.
Was there any diagnosis made at that time?
No, doctor, I didn't take it seriously. It went away on its own, actually, doctor.
And is this episode same like the before?
Well, doctor, not completely before. I think it's more or less same, but there are actually some other things this time. Okay, for the last 2 weeks, I think I have been experiencing some rashes in my legs. Okay, some redness in my legs as well, some red rashes. So I'm a bit worried, and also I have been experiencing some joint pain.
Okay, I can understand. And can you tell me that you have said that you have some problem in your vision and also pain? Have you got any injury to your eyes?
No, doctor, no injury.
Okay. Any excessive watering from the eye?
No,
Okay. Do you have any headache?
no, doctor.
Okay. And any do you use any spectacles or any
No,
contact
doctor.
lens?
No.
Okay. Then can you show me your eyes?
Yes, doctor.
Is it on the both side or same one side?
It is both sides, doctor. More in left, but it's both sides.
I can see that red eyes. And you said that you have joint pain and rash on your legs. Can you show me that?
Yes, doctor. There is some rashes in my legs. You can have a look at this.
Okay. And is the rash on your legs painful?
Yes, doctor. It's painful.
And for how long you are having this?
I told you for the last 2 weeks, I think.
And your joint pain?
For the same time, doctor.
Okay. And have you noticed that your joint pain is worse in the daytime or night time?
I think it's more in the morning. I think it's some jamming exercise, and as the day progresses, I think it slowly improves.
Anything makes your condition worse or better? Have you noticed anything?
Doctor, I think walking makes it a bit better.
Okay. I am going to ask you a few other questions. And
Yes.
do you have any rash, any other rash anywhere in your body?
No, in the body, actually, doctor, I have some rash in my mouth, I think.
Okay.
Soreness in my mouth.
Okay. And for how long?
I've been having this since the last 4 or 5 years. It comes and goes, comes and goes.
Yeah, I can understand. And is it painful?
Yes, doctor, at times it's painful.
And if it comes, for how long it persists?
I think it persists for around 3 to 4 days.
And it resolves on its own.
Yes, doctor.
Okay. How about your appetite?
It's quite well, doctor.
Any weight loss? Have you noticed?
No.
Any hot or cold preferences?
No.
Do you have any fever or any raised temperature?
No, doctor.
Any cough?
No.
Any shortness of breath?
No.
Okay. Any changes in your bowel habit? Have you noticed?
No, doctor. No changes.
Okay. Any changes in your water work?
Well, doctor, I think that recently I have been going to washroom for a bit more frequently.
For how long?
I think for the last 1 week.
Okay. And do you have to go to washroom at night?
For 2 times, I think, in the last 7 days.
Okay. And do you have any weakness at any side of your body?
Well, doctor, that's another thing. I think that you told. I think I've been feeling some numbness in my left side for the last since yesterday. I don't know if it's so serious, but I am feeling some numbness in my left side.
Okay. I am sorry to hear that. And have you ever had any cough?
No, doctor.
Okay. I am. Do you have any non-past medical condition?
Doctor, 2 years back, I had, I think, one episode of severe right leg pain, and I went to the doctor. They did some tests and told me that it might be due to some problems in my blood channels, and they prescribed me some medication for it.
Okay. Did they make any diagnosis at the time?
No, they just told me it was actually in the periphery. So they just told me about that there was some problem in my blood channels.
Okay. 2 minutes remaining. Okay. I'm going to ask you that do you take any medication?
No, doctor, not
Do
at this
you,
moment.
any of your family will have this type of condition?
I don't know.
Okay, I'm going to examine you at this time. Is it okay?
Yes, yes.
So I'm going to examine your pulse, and after
Okay.
that I'm going to see your eyes,
Yes, redness.
any redness, anterior, any signs of anterior uveitis, any pus in the chamber, anterior chamber, and after that I am going to see into your mouth,
Yes, there is some soreness present.
and I am going to auscultate your lung,
It's quite normal.
and I am going to see the legs and also for erythema nodosum and hands for any joint pain. Okay.
Yes, yes. Okay. So
So
there is some joint pain present.
may I know that do you smoke?
Yes, doctor.
Okay, I would like to recommend you stopping it. May I know that what is your concern?
Well, doctor, what's the disease actually? There is so many problems with me. I'm such a young man with so many problems. How can you help
May I
me?
know that do you have any rash in your private parts?
Doctor, that's a very private question, doctor. Well, I think yes. I have noticed this for the last 10 days. I didn't notice it before, doctor.
As I have taken your history, I think you are suffering from a condition called Behçet's disease, and I need to examine. I need to run some test, and after that, I can give you the best explanation. And one thing, can you tell me that have you noticed anything where you get injury, you get any abnormal skin texture at that time?
I cannot remember, doctor, actually.
That's not a problem. So, but that Behçet's disease, it is actually a disease where our own defense system attacks our body parts, and this type of symptoms arises. And for this, I need to run some blood test, and after that, I will make an arrangement with you, and in the meantime, I will give you some medication for your joint pain, for your eyes. Okay, is that okay?
Okay, doctor, may I know that will it be cured?
Actually, this condition can be suppressed or can be keep under control, but I am sorry to tell you that it has no actual cure. Time off.
Okay,
Thank
okay.
you.
Thank you, thank you. Well, that's all right. Well, so what is your diagnosis?
Okay, for this gentleman, I have my diagnosis is a case of Behçet's. My another differential is it is a case of sarcoidosis.
Okay, why sarcoidosis?
This because this patient have a history of polyuria and erythema nodosum with joint pain
Yeah.
and also
Okay.
anterior uveitis.
Okay, okay, that's very good. And well, I think sometimes Behçet's can also cause this type of dysuria, I think. Okay. So at times you didn't ask about any tummy pain while doing water work, so he would have told about it. Okay.
Okay.
So okay. So that could have been also asked. So that's all right. The DD is all right. And any other DDs?
For his erythema nodosum rash, I will also consider rheumatoid arthritis, inflammatory bowel disease. But for inflammatory bowel disease, he has no signs, any other positive history.
Okay. Do you think that regarding his age issues, do you think that you have missed anything important?
I think and it's systemic lupus erythematosus.
Well, actually, he's a male, so it's a bit rare in the male population. But have you asked about his exposure history?
No, I forgot to ask that.
Yes, exposure history and travel history. This could have been important because this kind of joint pain and oral soreness can also be present in HIV, and at times, along with Behçet's, this can be superadded as well. Okay, so if he has that exposure history recently, I think that's important. Okay, suppose you have also got the Behçet's history, but this HIV should have or should also be tested. Okay, if he has exposure history, and this patient actually had a history to going to Thailand 2 months back. So this could have been added here. Okay. Hello.
Yes.
Yeah. So I think that's all, and you have done very well, the counseling part and all those things, and the treatment part. And but I think you could have told about one thing that I think for Behçet's, I think apart from NSAID, you could have uttered the term cold kitchen. I think this is important. This the examiner would like to hear about the word cold kitchen, because Behçet's, I think for joint pain, cold kitchen can be important, and for acute enterobacteritis, I think you should utter the word steroids, because it can be a medical emergency. Okay.
Okay.
Yeah. So anything more to be added?
No, I have no much idea about it.
Okay. So I think you can stop the recording for this case. Okay.
Okay. Then we are going for the next case.
Yeah. Well, is Sonyapo present here?